Trident Pain Center is a pain management clinic located in North Charleston, and Dr. J. Edward Nolan joins me this morning to talk about how Trident Pain Center can help enhance patients' everyday life. Dr. Nolan, thank you for joining us this morning.
Thank you.
And let's talk about pain. You guys have been open since about 2002, and
Yes.
What is a pain management center?
Well, we try to provide pain relief of common problems that limit people's lives. We concentrate primarily on neck and low back pain, but we do cover quite a different variety of pains. And particularly lately, we've been treating migraines.
Oh, and I know a lot of people who have suffered from migraines. I myself have suffered from migraines, but you guys have a new procedure that you've been working on for several years now. It's called sphenocath, and tell us more about that.
Well, we take a small plastic tube and we use an x-ray to guide the tube to the right location, and then we inject some numbing medicine or lidocaine into the area.
And this is what it looks like right there on the screen.
Yes,
it looks like it's not really that invasive at all.
Oh, it's not. It's a small plastic tube that we do place up into the nasal cavity in the nose, and it can provide dramatic relief for migraines.
And so what are some of the patients saying about it, especially those who have been longtime sufferers and just thought that they would never have any relief?
Oh, it's dramatic. That's the only word for it. I had a gentleman in who had had a migraine for 30 years.
Oh, my goodness.
And he was on chronic narcotics for literally 30 years. And with one procedure, we were able to take his migraines away. And he actually came to the office. He had tears in his eyes.
Oh, my goodness. And usually, and sometimes you can have tears from having a migraine, but these were happy tears.
Happy tears.
So, but you say it goes up through the navel cavity, and by you looking through the x-ray machine, you are really able to target really right where it is, right where that migraine is.
Yes, ma'am.
Now, about how long does a procedure like this take?
Oh, just a matter of minutes.
A matter of minutes?
Oh, it's very quick.
Very quick. And do they complain of any discomfort from doing it? Is there any downtime? Or how soon should people expect to get some relief?
Well, they don't always, the headaches don't always go away immediately, or at least during the procedure. The next morning, most people have pain relief.
Now, who benefits most from a procedure like this? Is it someone who has to have suffered, have a history of chronic migraines, or someone who may have migraines here and there a little bit less frequently? Who would be the perfect candidate for this procedure?
Well, if they have migraines every week, at least once or twice every week, then they're a candidate for this procedure.
Wow. Now, is there any way to tell exactly what causes someone to have a migraine?
Well, most patients that I treat have had extensive workups, and the majority of them have just have to just live with a migraine. And so at that point, after they've had a workup and tried to determine to make sure that there's not some type of cause that can be remedied in other ways, then we'll do this procedure for them.
Now, Dr. Nolan, you would say, how many years have they been working on this particular procedure?
30 years.
30 years.
Yes, ma'am.
That's a mighty long time, and they pretty much have it right on where it needs to be, right?
And it's been a relatively new treatment. We've been trying to do it for 30 years to get it to be effective, and it's only been in the last year that we've really been able to make it work as effectively as it's working now.
Now, percentage-wise, what's the success rate of someone really just kind of knocking the migraines out completely?
Over 90%.
Oh, I would say those odds are pretty good.
It's dramatic. And and the results, like one of my employees I did this for, she's 26 and she's had headaches all of her life. And she hasn't had a headache since April of last year after we did this.
Wow, I think this is awesome. Now, if someone is out there and you're a chronic migraine sufferer, this might be something that you might want to take in consideration. So how would someone, are there free consults that you do, or do you consult with a potential patient?
Well, they just need to call Trident Pain Center and make an appointment, and we'll be glad to see them, and then we'll discuss the possibility of this procedure. All
right, Dr. Nolan, thank you so much. It sounds phenomenal, and if this little tube can really give someone some relief, I would think it's worth trying.
Oh, it's dramatic.
And you say it takes about 30 seconds, you said?
Oh, well, not 30 seconds.
Okay.
Just a matter of a couple minutes.
Just a couple of minutes. You can endure that. Dr. Nolan, thank you so much.
My pleasure.
All right, stay with us. Much more Low Country Live right after the break.